Healthy Choices, helping you live healthier. Sponsored by Intermountain Health.
Welcome back, everyone. Eating disorders affects tens of millions of Americans. Jennifer Wilkie, a registered dietitian nutritionist with Intermountain Health, to talk about some of the issues that can happen with eating disorders in this sponsored interview. Let's first talk about how common are eating disorders.
They are incredibly common. So eating disorders affect tens of millions of Americans. In fact, over the course of their lifetime, approximately 30 million Americans will be diagnosed with an eating disorder.
What are some of the signs? If you were looking at a loved one, what are we looking for?
Absolutely, and that's very important. Detection and intervention are key. And so some of the signs that you want to look for is someone withdrawing from life? Are they over preoccupied with food? Are they feeling guilty about what they've eaten? Certainly unintentional and rapid weight loss would be a key sign. If they're starting to become overly anxious, if they're starting to withdraw from family and friends, certainly throwing up after eating, that would be a key sign. Or eating a large amount of food in a very short period of time, but more specifically feeling out of control when doing so.
So when you might see one or two of these signs, what do you do as a loved one?
Absolutely, and that can be the tough part because you're so invested in that person's care and in their well-being. And so I would recommend first and foremost that you pull them aside, have a conversation that is mindful of your language, that you're sensitive to their feelings, and then seek professional help. That's number one.
Is there a difference between disordered eating and an eating disorder?
There is. So disordered eating is kind of the beginnings of an eating disorder when it's not necessarily life interfering. Once someone has a diagnosable eating disorder, it is a debilitating illness. It's a mental health illness that can affect someone's life, someone's relationship, someone's work, certainly their mental health. So it becomes something that needs to be treated.
Does it always lead to that, though?
Not always. So like I said, intervention and detection is key. And so if you see someone that might be struggling or showing those signs of disordered eating, that's the point when you want to swoop in and ask for help.
And Jennifer, what's so interesting, you think it's such a physical disorder, but it is a mental disorder.
It is a mental health disorder. So I tell my patients it's about the food, but it's not about the food. It could present itself in the form of an addiction or any other sort of mental health disorder, but it's the second deadliest among mental health disorders.
Which is so astounding. Let's talk about what dietitians, what their role is in all of this and how they can help.
Absolutely. So as dietitians, our number one role is nutritional rehabilitation. First and foremost, we want to make sure that the patient is medically stable and that they're emotionally stable and mentally stable, because suicidality is very common with eating disorders. And so what we would look at is either managing their weight or restoring their weight, making sure they're at a good point, they're at a healthy point in their recovery. And then we would set some achievable goals to move them towards recovery.
And when we talk about getting help, are there some barriers or people and patients who have some challenges getting the help they need?
There are, and I think what happens is a lot of times families and loved ones feel like they need to be the provider. They need to be the dietitian or the doctor or the psychologist. And so number one is seeking out help where someone is a professional and can help that individual. I would recommend going to intermountainhealth.org where someone can find additional help.
It is National Nutrition Month right now. Where can people find more help in terms of some resources and some education and awareness?
Absolutely. So intermountainhealth.org is where I would recommend going, and you can visit that website, find nutritional help, medical help, psychological help.
Thank you, Jennifer, so much. That information right there on your screen. You can always visit, again, intermountainhealth.org. Thank you so much.
Thank you.